the floor.
Hello, my name is Dr. S.C. Taylor, RN. Thank you so much for tuning in to my YouTube channel. I have another important tip to talk about today regarding getting patients up out of bed, especially for our nurse assistants who are taking care of our patients the majority of the time. Now, nurse assistants must know that before they get the patients up out of bed, the level of the bed needs to be low. Then, before the nurse assistants send the patients up, they must have shoes on or nonskid footwear. That's so important. Now, most facilities have these socks with the nonskid strips underneath. This is fine. But you cannot get patients up with regular socks on. Why? Well, because there's a potential for the patients and our residents to slip and fall, God forbid. Then they're transported to the hospital because their hip is probably broken. Then at the hospital, they can get what is known as hospital-acquired infections. These are infections that they get from the hospital environment and for the care that the caregivers give. So we don't want this to happen. So we need to adhere to infection control guidelines when giving patient care. Because after the patient slips and falls, and like I said, God forbid they break a hip and transported to the hospital, then at the hospital, they get infections, hospital-acquired infections for things that we didn't do correctly. And a few days later, the patient can die. So this is a very important tip.